Give a kind introduction. Thank you. I'll be presenting the data, the applied therapeutics trial, mainly the sorbitol level. So these are my disclosures as part of the trial as a site. So as Mary nicely and elegantly described SORD neuropathy this morning, this is a rare type of axonal CMT. Is likely the most common form of autosomal recessive CMT type 2. It's been recently described and a relatively rapid movement from the discovery to the therapeutics. So most patients would have a phenotype which is between CMT and distal hereditary motor neuropathy. And again, as we heard this morning, the pathophysiology is relatively straightforward with increased sorbitol level due to sorbitol dehydrogenase deficiency. Patients develop neuropathy, and if you can use a compound like aldose reductase inhibitor, you can break the cycle and reduce the sorbitol level. That has been shown in the Drosophila and rat model to reduce the sorbitol level and also improve the function in Drosophila. So there was a clinical trial that was done, it's still ongoing with the open label. The patients were enrolled, about 56 patients, and the placebo and active treatment. And in the month 12, there was a pause with intention to move to open label. So a few of the patients were lost in the clinical trial, but initial response was relatively promising. So going back to the basic demographics, the placebo and active arm of the drug, they were quite similar, including the blood sorbitol level. And the inclusion was that blood sorbitol had to be above 10,000 for the patients to be enrolled in the study. So they measured the sorbitol level in relation to other clinical outcomes, looking at different combinations, including absolute reduction in the sorbitol level, relative reduction in the sorbitol level, which is more or less similar, sorbitol level at the time of symptom onset that they described as sorbitol exposure, and also some other analyses they looked into. So they looked at the correlation between these outcomes and changes in the outcome measures they used in the clinical trial. There was an association between the sorbitol exposure and clinical outcomes, including CMT high, which is the quality of life outcome measure used in this study as a secondary outcome measure. And there was a significant correlation between the fat fraction and in the muscle MRI and the sorbitol exposure. And also there were baseline sorbitol exposure and functional outcome measures, essentially everything, including the primary outcome of the clinical trial, which was the 10-meter walk run, was significantly different between patients on the active and placebo arm of the study, and that was correlated. So there was a significant reduction in the absolute and relative reduction in the sorbitol level in the active arm of the drug, more than 10,000 in the absolute value, and then about more than 25% in the relative reduction in the sorbitol level over time that was sustained. And again, as you can see, ends are smaller towards the end of study because of the dropout after month 12. And these numbers on the end column here are incorrect. They are the total number of patients. It should have been the number of patients on the active arm of the study. But as you can see, the first column is the clinical outcome. The second column is the correlation between the absolute change in the sorbitol level and the correlation coefficient with the clinical outcome on the first column. And the last column is the relative change or percentage change and the correlation with the outcome measure. So there was a significant correlation with some of the outcome measures, mainly with the absolute change and also some with the percentage change between the month 12 and to some degree month 18, but less so in month 24. Obviously, there are only 10 patients in that group that were on the active treatment. So these are the summary of the adverse events. That there was no serious adverse event relevant to this study product. And then the most relevant adverse event was the elevated liver enzyme in, I think, 6 patients, and 4 of them, I think, or 8 patients, and 6 of them were able to stay in the study before without recurrence of elevated liver enzyme, and 2 of them rechallenged, but they had recurrence of the liver enzyme, but nothing major otherwise. So overall, I think the study showed some convergence validity to the reduction in the sorbitol level and the clinical outcomes. And there was an improvement, associated improvement with the reduction in the sorbitol level, both absolute level and relative level, suggesting that the treatment is pathophysiologically providing some improvement in the course of the disease. So, and they're generally safe, well tolerated.
Have any questions? All right. Thank you so much.
Thank you.
Appreciate it.